Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can thrive and be profitable and successful for years to come. As many of you know, the NSCHBC is a proactive organization with over 300 members, including legacy members that share their wealth of knowledge and expertise with each other, whether it be in legal field, accounting field, the revenue cycle management field, the business management field, value-based care, and more. We have every kind of consultant that focuses on the healthcare industry that you could want. So for this episode, I'm happy to welcome back fellow NSCHBC member and consultant, healthcare consultant, Deb Phairas. Deb, welcome.
Thank you, Terry. It's delightful to be back. I always enjoy this.
Yeah, no, I'm happy to talk to you today. And boy, we have quite the topic. As everyone's been, really dealing with the healthcare workforce shortage. It's not just a problem in the US, it's everywhere from what I hear all over the world. But I think a lot of people really felt it was all because of COVID, but now we're finding it's burnout, there's all kinds of things that are causing these shortages. I'm sure we still have, things that are coming still back from the COVID lockdowns and the burnout. But what I want to talk to you today is really looking at the workforce as a whole, because when I look at different articles on this and read what, the government has to say on their websites, Forbes magazine has all kinds of things on this. I'm finding that they're focusing, which I understand, on physicians, nursing staff, and clinical, but nobody looks at the administrative staff in healthcare. Are you finding that's happening too? And we do have a shortage there.
Yes, it's all across the board, but clearly it's more in the clinical staff. And MGMA just published, or they have those short surveys that they do all the time. And they said that the nursing staff this year, 2024, the availability was about the same as last year. So it hasn't changed. It hasn't gotten better, which is not good, but it's just kind of staying the same. And so that's where I see the people having the most trouble. But clearly it's the front desk, it's reception, it's billing, it's medical assistants, it's everybody, it's everybody all along the way. So it's kind of universal.
Yeah, what I'm seeing as far as too, when people say shortages, it's not just that we can't find warm bodies. We can sometimes find that, but it's having the right number of people with the right skills in the right place, the right time. And yes, the clinical staff, it's really tough right now because we just don't have the staffing. And I read something just this morning that said they feel we'll be 200,000 nurses short by 2031. And we're in 2024. That's not very far away.
Yeah, they call that the pig through the python because it's all us baby boomers that are going to be aging, and there's not going to be enough healthcare people to take care of us. So that's why they kind of shoving that pig through the python's mouth. It's really tough. But it kind of started in COVID, and one thing that I was always very concerned about is that during COVID, particularly here in California, the Bryman schools closed, which was training medical assistants, and that's front desk and back office medical assistants. And so the availability of the training programs has shrunk. And I can tell you right here in Napa, there were 80 people waiting to take the medical assistant training for over a year, and they couldn't find any RNs to train them to be professors or, instructors at the college, which was really, that's disturbing, it really is.
It really is. Well, there's a couple of medical schools out here, I'm in Southern California, and they said that, I can't believe I'm saying this out loud, but it's something published. They said that they were actually thinking of lowering standards in clinical acceptance and the boards and stuff, just so they can get more people to pass. And I'm like, no. We don't do that for doctors. We don't do that for pilots. We don't do that for people that, let's not do that. But that just shows me kind of the desperation a little bit where we're at as far as staffing. And I know your practice, you're a consultant. How do you staff offices when it's not just about, running ads and putting headhunters out there, when it's just people are so burnt out, they're not coming back in? What is your advice first on the clinical side?
Well, I'll tell you what, I've been teaching seminars on this subject, and I just did my whole MBA for MDs and managers, and I have 3 sections of finance, strategic planning, operations, and then personnel and HR. And one of the things that I just found was that Southwest Airlines, they are recruiting always, and they're saying fun is taken seriously at Southwest Airlines. It's life's too short and too hard and too serious not to be humorous about it. So and we all know that the flight Southwest Airlines, that's so true. And so one of the interview questions, which I really liked, was tell me how you used your sense of humor in a work environment, or tell me how you've used humor to diffuse a difficult situation. And in our case, we'd say with a patient. But, I think that what has changed is the younger the workforce is, the more culture is so important to them when they're deciding to take a job. And we have all these other industries that are have a lot more sophistication in terms of developing their culture and their values and things like that, that's appealing. So I've heard from my clients that that's a surprise to them, that applicants will say, tell me about your work culture. And they're kind of like, oh my God, what? So I think we have to really focus on that and having good values. Now, Terry, I don't know if you were with our association when we went to Zappos in Las Vegas, the company that sells shoes.
I don't think I was.
Okay. Well, that was really enlightening because they have amazing culture and people love to work there. And so I know we can't be as fun and crazy as some of these other industries, but we do have to be talking about that we can have some sense of fun and some enjoyment and things like that, because, especially Terry, we're competing here in the Bay Area with all the tech companies. And I mean, who wouldn't want to go to work with them when you can and I used to walk, my office was in San Francisco for many, many years. And then I moved to Napa, as you know. And I used to walk by these places and I'd see cubbies. You can bring your dog to work. They have coffee bars. They have beer in the afternoon. Yes, beer in the
Oh my
afternoon.
gosh.
Yes.
I want to work there. Shoot.
I know. So who wouldn't want to work there as
Right.
opposed to in a very tough medical environment that has
Right.
umpteen phone calls? Patients are not, they're not always on their best behavior because they're sick, they're worried, they're anxious, they're all these things. So one of the things I think is really important is taking the recruitment process seriously by being prepared and having, developing your culture and your core values so that you can tell people about what your core values are in your practice. And that makes a big difference with hiring staff. So they're not coming to work just because it's a job, and we want to get quality people. So I'm going to bounce around a little bit, but for one of the things, for front desk receptionists and some of the, auths people and things like that, they shouldn't be just looking at the medical field as where they've gotten their experience. And I talk about this all the time, is that
I do too.
yes, and I'm sure you do too, is that for the hospitality industry, they get a lot more customer service training for hotels and, places like that. And if you ever get a chance to hire somebody from the Ritz-Carlton, for goodness sakes, you better snap them up, because they've had a lot of training on excellent superlative customer service. So that's one of the things I try to tell my my doctor clients, is that don't just look at somebody that's in your specialty that has only worked in the medical field for some of these positions. Look outside that, and when you're advertising, say, we're serious about having people who have excellent customer service skills, that have worked in hospitality or the medical field. So I think that's a big thing that I'm seeing, that we need to look outside our own narrow little medical field for things.
Well, I have a funny story about that. So I was doing an on-site with a client that was down in San Diego, and I'm in the Inland Empire, so a little bit of a trek. And they're right by the big hospital system. They have about 200 physicians, and they have a McDonald's right there. And I love McDonald's coffee; it's just a little vice of mine. So I would go through the drive-through on my way there. I was going for 2 weeks, and the same drive-through gal, she was just so bubbly and sweet, and and not just headphones face down or whatever. She was just like, how's your day, everything. And I was like, well, she's really nice. And so I'd say, great, how's your day, and then after I think 2 weeks of that, she goes, oh, you're back. And she goes, and she would ask, what's your name? And I'm like, Terry, what's your name? And and she's like, oh, great. And it was kind of funny, kind of a little camaraderie. And about the 2 weeks in, I said, have you ever thought about going into the medical field? Or she goes, oh my gosh, I've been trying to get into something different. I've been here for 10 years. And so I, not to poach an employee from, that kind of position, but still, just seeing if she was doing something different. So it turned out I got her a job as front desk, and then an appointment scheduler. And what was funny about this is that she is now one of their most successful employees. She ended up taking a test to also be a coder. But she knew most of the patients coming in from that drive-through position. So they said that she was just like, oh, hey, how are you? And they knew her. And it was like this, it started to be fun, like you said, because people were like, I know her, I've seen her out. And oh, I'm so glad you're working here now. And she was just like the biggest cheerleader for this practice. And I remember a couple of the physicians are like, I don't know where you found this gal, but my patients love her. And they're like, do you think we should move her to the back office? I'm like, move her wherever you think she'll be successful. I said, she loves working here. So, then they kind of helped her out, get her medical assistant, and she's now in nursing school, and she is still working there and loves it. And it was just so funny, just the evolution, like you said, look outside the box. And, fast food, restaurant, hospitality areas, those are hard jobs. Those are hard jobs. You're in front of the public all the time. And I think a lot of people have gotten so used to working virtually that they don't see the public, and they don't realize there are jobs out there that aren't virtual. And
Yeah.
so if you find people that have that, extroverted personality, that's good, and you can really utilize them in a space that maybe you didn't think off the bat, you might want to consider it. Because even though we're really, bleeding the nurses and physicians and burnout in the administrative or revenue cycle end of it, and in the front desk and all that, we're also really hurting for staff. And it's the right staff, and it's the people that, the first line people that your patients see when they walk into your practice. Even if you're a virtual physician, they're going to see you on camera. And, they're going to need somebody that the facilitator that understands that. So I don't know if you've experienced that, but going into other industries and pulling people from there has really been helpful.
Yes. And, one of my good practice administrators calls the front desk position the director of first impressions.
That's a great title. I love that.
I know. And, I like that too, because it's true. And, over the phone or when they walk in the door, that is so essential. I was just in a pediatric practice, and they actually terminated the front desk receptionist. And I was observing, doing a practice assessment, and I thought, she's not friendly, and turns out she works 2 jobs too. So she was tired all the time. Yeah. So, I think that's another thing. We have to have adequate wages, and we have to do a lot of training. So I always joke with my physicians. I say, you want to fill that space like just with a warm body, and that's not it. We have to make sure that we're doing a good job, and we have to continuously train our people. So one of the things that I love to do is my customer service training for office staff, because we have a lot of fun doing it, and I have skits the right way, the wrong way, and they really get it, when you make it fun to even learn. But I think that's another weakness in the medical field, is that we are not focusing on customer service training for our existing staff and our newly hired staff. Right. So I really believe in that as well.
Well, and one of the things I make our physicians do, my clients that I talk to, when they're talking about, where's the leakage, where's the problem, they think it's places that it really isn't. I have found. But I make them sit in their front desk for a while. Just, walk in one day, we're in plain clothes, and just go sit out in your waiting room and see how, your patients are treated. And I did that in one of my orthopedic practices. And the doctor goes, well, first of all, we have really uncomfortable chairs out there. And I'm like, okay, there's one. And he goes, we got to change that. But the second thing he noticed, so I guess this patient went up to the front desk, and he had crutches, and they try to hand him a clipboard to fill out information and they, not even paying attention to the fact that he couldn't handle everything, and just kind of like left him sitting there, and he's trying to put it under his arm while he's trying to walk with crutches. And he's like, I ended up going up and helping the man sit down, and they realized it was me, the doctor. They didn't even know I walked in, and they were like, oh no. And I'm just like, some things are too, I don't know, I don't want to say robotic, but you know what I mean. They just aren't paying attention to the needs of what's in front of them. And I think sometimes, seeing how your first impression is, like you said, is really important. I think the doctors need to understand that. I was at the doctor not just recently for a well check, and as I'm leaving, they gave me paperwork that didn't belong to me. And I was like, I go, oh no, my name is not Victor. I said, here's a HIPAA violation. And it had all the diagnoses and all his information. Terrible. Yeah. And I stopped at the front desk. I go, okay, so you have 3 HIPAA violations here. You did this to the wrong person. And they're like, oh no. And I'm just like, yeah.
Well, to follow up on your story is that I usually tell this in my classes about my cousin's experience at Mayo Clinic in Rochester, Minnesota. When she went there for a pretty serious thing, afterwards I asked her, I said, how was your experience there? Because we'd taken my dad there and we had a wonderful experience. But she said, the staff were so great. I was trying to get in here. It was winter and I was struggling to take my coat off. And, the front desk receptionist came out from around the desk and helped me and brought me the paperwork, and then came back and got my insurance card. I didn't have to get up. And so, and she was just so impressed by that. And I said, well, how was it? How were the doctors and everything? Oh yeah, they were great too. Yeah. What really stuck in her mind was this, that she'd never experienced a receptionist coming out around the desk to help her. Just like you were saying, I mean, that should have been a no-brainer to say, again, guy on crutches, we should go out to him rather than making them come up to the front desk. So it's just being aware and, thinking about what would be a better patient experience for our patients.
Well, and you brought up something really important too. I think some things that's missed in practices when they're hiring staff, and, we're talking about personalities and compassion and understanding the needs of the patients. When patients get surveys from their payers, from the insurance companies, from the health systems, they ask them a list of questions about their experience. And that also affects if they're going to re-sign with that provider and continue to have them as a preferred provider. And it's funny because you had mentioned something that I found on these surveys. Question 9, 10, and 11 is about the doctor. The first 8 questions is about the staff and, and check-in times and were you acknowledged and, things like that. So even though it's important that, you're a good doctor, the staffing is a really big thing for payers.
And that's so true for all the rating organizations like Yelp and Google and things like that. Is that you'll see that the staff are oftentimes the one that get the criticism, not the doctor, but it still goes on the doctor's review. So, somebody should be reviewing those and making sure that they're training the staff, not singling them out, and never, ever responding. I'm just going to tell you that right now. You never respond directly back to a patient on a rating sign. No. Yes, Susan, we're sorry you had a bad experience. The California Medical Association and many of the others will say, that's a HIPAA violation. And you should say something like, we take our, practice seriously. If you are our patient, please contact our practice directly so we can resolve this problem. That should be the response. Yep. Nothing else.
Nothing else. Right.
And,
well, you're in Napa, and we've come visit you in Napa before, and you and I've been to wineries that the wine can be perfect, but if the experience sucks, we're like, the wine really wasn't that great, or the wine can be just okay, but the experience, remember when we went to Alpha Omega with the, the water view and all that, it's like, but the experience made the wine taste better. Same thing in healthcare.
Well, they also have good wine too.
That's true. Same thing in healthcare is that it's the experience. And I think with, right now, limited options in staffing, we have to really look at hiring quality people if you can find them and go outside the box. because right now unfortunately we've got a big imbalance between need and supply. And so what are you finding as far as, I know some practices are going to recruiters. Are you finding that they're helpful at all?
Well, I actually do recruiting only for managers and above.
Okay.
But they have many of my clients will do that because it's just so time consuming. And I understand that, but I actually think you can do it yourself. I mean, it's so easy to put a good long ad on Indeed or ZipRecruiter, or if it's a manager, LinkedIn. Those are really the biggest, and MGMA for healthcare managers and administrators. I think you can do it yourself. It's not that hard, but you can't just rush that process, and you have to wait for quality people and, do your job with that and interview and do background checks. That's so important. I believe in drug screens for staff as well, because that also, people with the drug habit have a tendency to embezzle. So that's another issue, of course, in the
Oh,
medical
wow.
practice. And so I really think that it's not that hard. And I was during COVID, we were doing webinars for ADAM, the derm administrators, and we had a huge roundtable about talking about recruitment ideas. And, we saw that they were giving retention bonuses to their existing staff. They were giving a monetary award for people who had recruited staff, like, they knew somebody, so getting the word out that way. So I think we just have to be more creative about how we're going to find people, and good quality people, and not rush that process. Wait for the good people, because turnover is expensive. So hiring in haste is a waste. It
Yeah,
really
no, it
is.
really is. Well, and you had brought up something really important, and I'm finding more and more practices are taking too many shortcuts, where I've had two practices, not clients, but they wanted to be potential clients. And they said, we have a problem. And I'm like, that's not the way to open to be a client. Hi,
Well,
I already
that's
have a
what we're gonna
problem. I'm like, wow. But both of them actually in different parts of the country, they were saying that they hired nurse practitioners, one hired a PA, and they didn't verify credentials, and they
Oh,
weren't licensed, and they weren't, they said they were that, but one of them had their license expire. One had it revoked in a different state, and they already started billing and already started submitting claims. And then they've tried to get them credentialed with Medicare, and they said no, they're not qualified, And I was like, oh shoot.
well, that's an essential for any licensed people. You have to do the background check, and there's lots of excellent organizations. It's not that expensive. It's maybe $125, something like that, to
Yeah.
do a background check. And there's a student education just to verify that if they had a college degree too, or went to a program, and that's really inexpensive. I think it's like $25.
$25. Yeah, I
So,
checked that too.
right. So you have to take that step. And I mean, I was trying to tell this to a dermatologist. He wanted to hire this manager, and I said, well, the background check isn't back yet. And he goes, but I need her now. I have to have it now. And, I'm going to make her start. And I said, I really don't think that's a good idea. And turns out the organization was doing its due diligence, and she had embezzled
Yeah.
from a practice in Arizona. And part of her requirement was that she was required to tell any potential employers about her criminal,
Oh,
past.
geez.
She did
Would
not.
anybody hire with
So,
that? Wow.
we terminated her immediately after finding that, but he really learned a lesson and said, same thing. Next time, Deb, I'll listen to you. But, I said, I wasn't trying to be difficult or, anything. I'm trying to protect you,
Protect you, yeah. Yeah, I
And because
understand.
these people hop from state to state and,
They do.
practice to practice, and it's really horrible. So do take that time.
And a lot of the staff, they present so well. I mean,
Mhm,
if you've done something shady, you probably know how to manipulate. So always
mhm.
keep that in mind when you're out there, talking to our listeners. But Deb, what is it that you do when it comes to recruiting or staffing or helping? What if somebody came to you? What could they hire you for in this space?
Well, like I said, I only recruit now for managers and above.
Okay, so
But
administrators, managers,
yeah,
CEOs. Okay.
managers, administrators. I'm in the process with a chief administrative officer for a retina group right now, and that is just more worthwhile. But for my existing clients, if they need the background check, I'll do that for them and just charge them for the background check because I have an account. So I will help them with that. And sometimes, it depends on the client. I will oftentimes give a second opinion. Sometimes if they're between two candidates, I might sit in on a Zoom or something like that. I'm when my clients ask me for stuff, it's hard to say no.
You're so nice. You're so
Problem.
freelance. What do you need? Well, now, do you tell clients now if they're, trying to recruit instead of, going to a headhunter or trying to figure out if putting in an ad, do you have them go to the local colleges? Do you have them medical schools? How do you get them to find, people now?
Well, it depends on the position. So, again, is that we just talked about what you might want to do with front desk and those types of people, even from the hospitality industry, putting out a good ad, and not just scrolling through them and to say, oh, they don't have any medical experience. But the medical assistants, yes, the schools, the few that are left. And then obviously, I don't do recruiting of nurse practitioners, PAs, and physicians. There are organizations that specialize in that. So
okay.
I think that's, and I know of several, and that's all they do, so they specialize in that area. And I think that's the way to go because they're in there in the residency programs. They have contacts within other big medical groups, and sometimes they were, try to steal away from Kaiser and places like that. So, I don't do that. I never poach from an existing client. I just will not do that. However, if somebody responds to an ad of mine of their own free will, then of course I'm going to consider them. And,
Right.
That's, but I don't make calls and I don't poach.
Yeah, that's good. No, that's good. No, it's just, I think a lot of providers that listen to our podcast are wondering, well, can I do it on my own or should I really go to an organization that specializes in recruitment?
Well, again, I know of some in the Bay Area that do recruit office staff and they're good. In fact, one of our board members for Northern California MGMA is a medical practice recruiter. Again, I do that, but and then you have to go and I think that for any of the clinical people, you should go with some organization that is in the medical field, not just some overall, recruiter.
Well, and then remember, once they recruit them, then you really need to make sure you've got a good healthcare attorney for contracts and all of those disclosures and everything because every state is different.
Right.
And I've seen a lot of clinical people, meaning mid-levels and physicians, working without a contract just on what they think should be, and that's just never works out for anybody.
Yeah, written employment contract is important for those professional staff. I don't think that's necessary for medical assistants or office staff. Just having an excellent personnel policy and procedure handbook and all the forms that go with it. So an offer letter, which states things that if they're non-exempt or exempt, their usual working hours, although always the caveat that may change. But outlining all of those things is very important, and the employer signs it, the staff person signs it, and it goes in the personnel file. And then having a good personnel policies and procedures handbook that they have to read when they come to work. And they have to sign a paper that says they've read, received, and understood the personnel policies and procedures, and that goes in their personnel file. So those are things that are, all right. So I have risk management background too, because I worked for a med mal company before I started my business. And we always used to say to the doctors, if you didn't chart it, you didn't do it. And it's the same thing with labor law. If you didn't document it, you can't prove that you told the person what their performance issues were. If they were doing something really horrible that deserves immediate termination, like bringing a firearm to the office or something like that, those things are really important. So I find that doctors have a tendency with their staff to just do verbal feedback and they're not documenting it. And that's very, very important.
Well, and lastly, and I'll kind of close on this, one of the things I do find, and you can just chime in on this real quick, I'm big on compliance as well, and I find when I say, can I see your compliance policies, your compliance manual, they look at me like they don't have one.
Right.
And so when you're looking for employee policy manual or anything like that, I also find that a lot of practices don't have them.
Yeah.
So,
Or
oh
they
my
haven't kept it
goodness.
up to date, Terry.
Yeah,
You
yeah.
know as well as I do, in California, the laws change every
Every day.
January.
Yeah, and
So
every
you
all the
have to
time.
update it. And I'll give you a source of really good information. It's the California Chamber of Commerce. They
Okay.
have an excellent HR kind of service for updates, and they have all the 5 pamphlets that we're required to give staff when they come on board. So I think, utilizing, if you're in another state, possibly your state medical association or your state chamber of commerce are excellent resources for you.
Yeah, no, I agree. No, that's great advice. Well, Deb, I'd like to thank you for being our guest on today's podcast. This has been great information, and thanks again for being here.
Always a pleasure, Terry.
To find Deb and her contact information, you can go to the NSCHBC website at nschbc.org and click on Find a Consultant. Type in her first name, Debra, Debra, and her information will appear. Also, as a reminder, the nschbc.org website offers monthly free webinars on a variety of topics, as well as a quarterly Medicare regulatory update. Please go to nschbc.org and click on the tab Upcoming Education. Our next Medicare second quarter update webinar is Tuesday, June 25th at 11 a.m. Eastern Time. I am teaching that one, so again, go to nschbc.org to register. That's it for us today, everyone. Make it a great day, a great rest of your month, and thank you for listening to the award-winning NSCHBC Edge podcast. I'm your host, Terry Fletcher.
Thank you for listening to the NSCHBC Edge podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.